Yeah. So just a couple things, Dr. Anjali. I know you've done this so many times before, but when you start now, so what I'll do is I'll start with the introduction, and then if you can just, I'll give you a pause. So if you can just move to the next slide, and I'll say like, Dr. Anjali, we're so glad you're here with us. I'll turn it over to you, and then you can start from the disclaimer page, like saying I don't have any conflicts. And Mahase, it's completely up to you. I won't have my video on throughout, so it'll just be you.
Okay, okay.
Even through this. And then if you ever like, if you think that there is something that you want to like maybe redo or like say something, so just start from the beginning of that point so that it's easy for us to edit. So, and then if you just want to like take a pause, just feel free because we'll work on that. Okay. Let's go.
Yeah.
Okay. Start recording. Greetings from Dehradun. My name is Jessica Gabriel, and I'm very excited to be part of this year's India's Online Lactation Conference team. As you know, this conference is for clinical updates in breastfeeding practice. As we were planning this conference, we wanted this to be practically focused on all of you who are practicing lactation all across India. We are so excited to be with you all and to learn and to grow together. Next. For today's session, we'll be hearing about Teamwork 101, how physiotherapists and LPs can work together as a team. I'll now turn it over to Dr. Anjali. Dr. Anjali, we're so glad you're here with us.
Thank you, Begin India and Lactation for growing together as a team of physiotherapists and LP working together, collaborating together for the welfare of the postpartum mothers. So we'll be talking about how physiotherapists and LPs can work as a team. Myself, Dr. Anjali Agarwal, consultant physiotherapist, lifestyle consultant, and women's health physiotherapist. I practice out of Hyderabad, and I've been dealing a lot of musculoskeletal issues for adults, children, and senior citizens. At the same time, pelvic floor rehab for moms, along with a lot of work for postpartum mothers with diastasis recti, which is the mummy tummy pooch. And as of now, I'm available online for telehealth consultations. Based out of Hyderabad, I've been able to help a lot of mothers all across India and the world. So let's start the session and let's work together as a team and understand how it's going to help each one another and form and collaborate for the best interest of our clients. So there's been no conflict of interest, and we understand that we are working as per the WHO Code of Marketing Breast Link Substitutes. That's a bit of instruction about myself. I have about 20 years of clinical experience, and at the moment I've been practicing on telehealth base for pandemic time out of Ambicare and the birthplace Hyderabad. Having been trained in the UK, I worked with the NHS UK and graduated from SSKM Hospital IPGMR from Kolkata and did my preventive promotive healthcare diploma from Apollo Hospitals, Hyderabad. And also been trained into a house manual facilitator training from NHS Lothian, Entry Hospital, Edinburgh. I'm an advocate of safe birthing practices and also help women to spring back to life postpartum. And I've been running a program called Postpartum Pilates, which is also run online. I've been a brand ambassador for Physical Literacy Days program run by Pulela Gopichand Academy, based out of Hyderabad. At present, I've been also been a convener for Health and Wellbeing, Indian Women Network, CII, Telangana 2018 to 19, and co-convener in the year 2017 to 18. That's my brief introduction, and I bring about a plethora of experience in my talk today as I deal with a lot of issues postpartum, and I think most of the patients or the mothers, they can relate well with the LPs and they can, talk about their painful journeys, which might hinder their process to be able to feed better for the kids. Now, my main topic for all the LPs to understand is torticollis and breastfeeding. So most of us as physiotherapists would actually see a baby or an infant with a neck turn to one side or a shortened muscle, either on the left or on the right. This probably happens when the mother is not letting the child to sleep in the right posture, family members are not holding the child in the right posture, or the child is born congenitally with this defect. Now, because of this, as a reason of this, many of the times mothers will face challenges to breastfeed their child. And often, when you go and meet the mother, and you'll find that these are the issues which the mother is facing, you need to contact the LP or the you need to contact your friend LPs who are dealing with it along with your physiotherapist and work them together and refer these patients to them because they are the ones who will be helping the child reactivate the muscles which will be responsible for him or her to feed better. Now, there is a protocol for pediatric physiotherapy which will be done by the physiotherapist, and the physiotherapist will let the child get back his natural length of the muscle, and by which the mothers will be able to feed their babies well. So it's very important. This is a very important topic because mothers and the LP and the physios have to work together to help the child. It's not a one man's job, it's a team effort, and all LPs should understand that they need to refer this to the physiotherapist and not term it as torticollis until unless the physiotherapist has ruled out whether it's actually coming into the category or being categorized as having a flathead syndrome or torticollis. Now, how would you understand as a LP or as a mother when the mother will tell you that my child or my baby is not having, being able to latch well from one side of the breast, or tends to feel, repulsed when he comes to one side of the breast, or feels very much cranky when I bring him to either the left or the right side of the breast. So it's a relatively common condition, usually occurs when one of your muscles of the baby's neck has become damaged in the uterus, or making it hard to turn the head to pulling it to head to one side. Now, if left untreated, torticollis can cause like flattening of the head to one side, and that is called as positional plagiocephaly. So these are little terms which I'm telling LPs to understand because you will need a whole pathophysiology to understand why it's happening and what it is. If you have a background of medical, career having been done, worked in the medical field for 4 long years, or you graduated out of a medical school, these are easily acceptable. But sometimes, just being an LP, you will only have to understand the basics, which is that the mother is talking about the baby's not turning to either side of the breast, having aversion to come to one breast, just basic things. If you understand, that's the time to draw a green signal and let the child come and visit the physiotherapist. So in addition to the tilted or the crooked neck, this is what the challenge the mother will talk to you about. Now, what are the challenges these babies will feel or suffer is side to side turning will be very difficult. Imagine if you as a person has a neck pain any time of a day when you get up in the morning and there's a neck spasm, you're not able to turn the face or not able to look into your computer. You really call your physiotherapist to turn your neck back in position. So the similar concept will be used for the child, but it's a very painful process which we as physiotherapists need to correct for the child. So, and there is painful sore nipples. The mother will often talk about, breast being inflamed, or, there's sore nipples, and there's constant repulsion from breastfeeding. Many times, the LPs will not understand that I am doing my best. I've taught my mothers the best technique to breastfeed. But why is it so the child is having all these issues? When you think of these issues, it's better to report to the physiotherapist and take their opinion. Because physiotherapists form a team of a postpartum checkup. They any which ways would be coming and seeing the mothers for postpartum issues. And that is a time when the mothers might end up talking to the physiotherapist straight away, talking about the breastfeeding challenge that she might be facing. So it's always good to work together and be in constant touch with the LP and the physios together. Now, the first observation for the baby has, have you noticed that the baby only turns to one side? So you'll see the eye of the baby will not be turning to one end of the room. He's always constantly looking at one corner of the room. Does the baby have a flat head? Do you see if you run your head over the baby's head, it is flattened. So as LP, I won't want you to do that kind of examination for the child, but let the mother understand that if it is there, and then to straight away go see a physio. Does your baby have an easier time latching to one breast while struggling with the other side? So these are constant things which we will ask the mother. Report it down with the basic observation which you feel these questions the mother has said, and then straight away refer them to the physiotherapist. Now, the common things which postpartum mothers will have challenges will be a lot of pain around the tailbone, pain around the hips or the buttocks, and pain around the tummy area. And they'll have lower back pain or pelvic pain. Pain because if they have given birth in a normal way, they might have pain because of their episiotomy scars and all. All that puts a lot of strain on the women and would also challenge her to feed in a better way or feed in a proper way. So if the mother is like having coming and telling you that I'm not being able to feed my baby, I'm having problems feeding my baby. Now, this is possibly because the mother is not healthy, mother is not feeling stronger, mother is having some issues. So generally, as a postpartum health check, physios will see the mother. But if you really feel that the mother has not been seen by your physio, that's the time that you shouldn't even term anything as whether it's a pelvic pain or whether there's any kind of bodily, discomfort which the mother's feeling. But straight away, ask for a physiotherapist opinion on the mother. Now, lactation professionals should also look at what way the mom feels comfortable postpartum. Any issues will cause issues to breastfeeding. That's one word of advice to all the LPs. So, a happier mother is a happier baby, and a happier breastfeeding experience will only come when the breastfeeding mother is sitting well, thinking well, eating well, and doing her best when she has to hold the baby for long, long hours every time she's breastfeeding the mother. So all that alignment, posture, bodily mechanics, all these comes under the framework of a physiotherapist. So you got to get them, together and get them heard and get them sorted out, all these issues. Now, postpartum issues like back pain and there is a big tummy. You might see a mother immediately post birthing, like after 6 weeks, if the mother has a very big tummy, and post 6 weeks, if she's continuously complaining that she's not able to concentrate on breastfeeding, perhaps there are some bodily issues which is kind of challenging her to feed a baby. Though being a mother, though having a motherly instinct, she'll want to jump to breastfeed, but there'll be challenges coming because of our own discomfort, which has happened postpartum. So such issues can be reported to the physiotherapist for easy access for pelvic floor postpartum physiotherapy. Most of us, we will also refer as physiotherapists to LP if the mothers think that they've not been able to have a satiety in trying to feed their babies. So we work together and we should always try to do that also. Now, postpartum weight loss guidance, if the mother is coming and saying that she's going to the gym and she's under the guidance of a trainer and trying to lose weight, all these issues might cause her discomfort. So, as you are a healthcare practitioner dealing with a mother who's breastfeeding, if a mother injures herself, she'll be again trying to withdraw from breastfeeding. And again, it might cause challenges for her breastfeeding. So, it's better to call upon the physiotherapist and report that a mother is trying to lose weight in a unscientific manner. So it's always good to try to kind of motivate her and kind to counsel her that she needs to see a physio and then get a weight loss journey planned by them. Now, issue in the wrist. Many of the mothers will not be able to hold the baby for long hours, and most of these mothers suffer from pain in the wrist. Commonly, we term them as carpal tunnel syndromes as physiotherapists, but you will always see a mother having pain in the elbow, shoulder, anything which is with pain, refer to them to the physiotherapist. Just simple thing, call the physiotherapist, let them know that there is an issue a mother is having. Don't have to tell them what issue she's having, but you have to say that I think she needs your help. Let's see the best possible ways she can get the help from you. Now, how will the physiotherapist support babies with torticollis? Now, as I termed about the neck being crooked to one side, mostly it's a pediatric physiotherapist who comes to identify this early on. And steps which can be taken by a physiotherapist is to increase tummy time, help the baby to lift the head up, and then work on those muscles. And then she teaches the mother to help the baby to be put in a very good position, which can help to roll the blanket to keep one side of the head from tilting away. And sometimes the baby might be not advised to lie on the tummy because of the risk factors attached to suffocation and sits. But all these little things we can work on, and we can decrease the incidences of tilted head or flathead syndromes. So that's my picture of a baby being held and treated by me. Early on, the baby had Down syndrome and also had a tilted head, also had hypermobility, which we also deal with because a baby has a low to muscle tone, will not be able to go on to the mother, go on to latch well on the mother. So always remember, we have to start early and teach early because habits form and habits will form with how the brain will remember. So if we do it early, the baby tries to adapt very early. So your role as LP should be to refer as fast as possible. Don't delay because the life of the baby will depend on you sometimes. That's my word of advice to all of you. A baby with torticollis is at 6 months. That's a happy baby. The baby was always crying when the baby would come to me when we were doing the torticollis arrangement for this baby. And within 2 months of the session, baby is all fine. The neck is all good. Baby's able to latch well. Neck is visible. The neck will not be visible many of the time. The right earlobe not touching the shoulder. So generally the earlobe will go and touch the baby and the neck will be all crooked. So it's very important, just not cosmetically, but for the body to function well, for the body to adopt to good posture, we are responsible that the baby's challenges which the baby feels during the breastfeeding times are reported to the physiotherapist because we do some magical touch to the baby and we can rectify a lot of issues early on. Then there's our self-stretching, self-maneuvers, which we teach the mother before the breastfeeding time. She can do these actually, and these are very, very helpful if they are being taught to the parents. Both parents can do it, and most of the LPs can ask the mothers, "Are you getting help from the physiotherapist?" And you're able to do the stretches, do them, counsel them, motivate them prior to each time of the breastfeed. So the mode of referral is we are a team. We work with pediatrician, lactation consultant, physiotherapist consultant. Many of the times we are not aware of each other's portfolio of work or our domain of work, but we all have to work together to form a team. And we are all interdependent. If our child is not getting healthy, it's not putting on weight, the pediatrician will surely refer it to the lactation consultant. If the lactation consultant said the baby is having times, challenges with feeding, they have to call upon the physio to rectify the bodily challenges which the baby has. And all in all, we are all working together for helping the baby and the mother. So over to Jessica. Can we start on the questions?
Yeah, thank you, Dr. Anjali. Dr. Anjali, if you can just pause your screen, I'll share mine so that I can go one by one on the questions.
Pardon?
If you can just pause sharing your screen, I'll share mine so that we can just.
Okay. Yeah.
I can still see the screen.
Should I do stop share?
Yes, please. Okay, so let me share mine. Can you see my screen?
Yeah.
Okay. Let's start. Dr. Anjali, thank you so much for a lovely session. Now, for the next part, we have a few questions that we'd like to ask you so that we can have a conversation with you. So to start with, can you share an example where you use teamwork to support a family with a lactation professional?
Right. So, Jessica, we had a mother who was having a lot of issues, trying to feed the baby. And then she was my prenatal client, actually. So I was part of her birthing journey, and she had a normal birth. And immediately, that kind of a connection which forms between a physiotherapist, a pelvic floor physio, and a prenatal mother going into becoming a postpartum mother was very much there, because she had pelvic pains and she had body pains postpartum too. So she started to work on her body immediately because she knew me already. But the biggest challenge she had was trying to feed her child, right? And now the feeding the child, the biggest challenge was she had sore nipples. The babies was totally reversed from coming to the nipples or latching well. So that's the time, because I work a lot with torticollis child. When we could note the child already had an inborn torticollis. So at that time, I did my work, what I would do as my physiotherapist training for helping the child and helping the mother both. I had to take both as my clientele. The small baby, the new infant which is born and unable to feed, and the mother who has pelvic pains. So we had to work together. So at the same time, I had to get few of the hospital lactation, based nurses and professionals to come and help the mom to get those, the milk, supply to get better. She was taught the right way to feed the baby, and along with my help and along with the LPs who were in my hospital and my clinic, we all could get a successful latch for the baby. And the baby kept on working with me for the torticollis, because it takes about 2 to 3 months. But every time the lactation professional would sit with me, would understand the correct way to get the baby the milk, because sometimes these babies cannot feed from one side of the breast. So there are positions which we teach the lactation professional, and we equip the mother to understand it if she's trying to go away from that city for some days. So that's how we work together, Jessica.
Oh, that's lovely. That's wonderful. Uh, how do you use virtual consults to support families?
Thank you, Jessica. That's a lovely question, actually. Yeah. So since the time of pandemic, I think a new age virtual consult, gave rise to a lot of help for all the patients of mine all over the world, all over India. And I've been using a lot for a lot of bodily pains, muscle injuries, pregnancy care, postpartum care, and a lot of mothers who are postpartum, they end up with something called as the diastasis recti, which is separation of the abdominal muscles or the mummy pooch. So many of these mothers may not have a specialist near to their city to visit. And I think if somebody sitting in Ahmedabad has been able to take my expertise help in case of dealing and treating diastasis recti, which we do online. So we decide on the sessions and we do it kind of like maybe a 2 weeks program or a 3 week program or a 1 week program. Anybody having back pains, any mothers having tailbone pain post their deliveries, we work together with them for our virtual consults. So there been a time when one of the lactation consultants referred a mother who was having a lot of pain and had issues with pelvic floor, was not able to go to washroom or evacuate, or was constipated for maybe 10 days post her delivery. So the lactation professional referred her, and we worked on her pelvic floor all virtually. And she was very much in actually in Dehradun, this mother, and we worked to help her, get a constipation treated virtually, get a pelvic pain get better, and then she was able to have a wholesome experience of feeding the baby without the aches and pains.
Wow, that's amazing. Yeah, definitely. I think the pandemic has taught us to connect virtually even better than before. Dr. Anjali, what piece of advice would you give a new lactation professional when working with a physiotherapist?
Right. So most of the times when you see a mother is uncomfortable, the moment you see a mother is having some kind of a question mark when it comes to breastfeeding, always try and understand that there might be physical challenges which the mother has. So respect it. Do not rush into trying to advocate breastfeeding straight on, because a mother who has gone through the birthing process, sometimes she might have traumatic birth experiences, and that causes a mother into a postpartum depression kind of phase in early on weeks. That is a time when we will have to look at that we refer the mother to a physiotherapist, and we also try to work around a situation where you can take some advice from physiotherapist so that the mother can sit in a very comfortable way and feed the baby. Most of the times, within the 3 months postpartum, when the child is born, when the infant is born, we as physiotherapists do not advise mothers to lie on the side and feed the mother. So you might have to talk to the physiotherapist and take on this advice from them. Why is the mother not allowed to lie sideways for the first 3 months? The biggest challenges the mother faces in the first 3 months is she might lie on her side and give rise to an issue with the pelvic pain, give rise to an issue like a tummy which is not going away. Basically, the postures of breastfeeding will decide her future with terms to being a healthy mother. So you will have to try to work around the solution with the physiotherapist advice and find ways and good postures for the mother to sit in a comfortable way and feed the baby. Thank you.
Yeah, that's wonderful. Dr. Anjali, once again, we'd like to thank you so much for your time, and we really look forward to working with you again. Thank you.
Thank you.